When Alice was a baby, she wasn't meeting her milestones. We noticed Alice, the side of her back was big.
Alice's scapula would poke out almost like a little chicken wing. And that kind of prompted us to get her checked out.
The physical therapist at the time, she believed it was scoliosis. We made an appointment with Dr. Barsi when Alice was 12 months old. We got an x-ray of her back, and it revealed a 58-degree curve. And we've been a patient of Dr. Barsi's ever since.
Alice, I have actually known since she was a baby. At that age, she's way too young for any surgery. She's way too young for even bracing. So typically when curves of that magnitude at that age, we recommend a series of casting.
The first thing you are worried about is how you're going to fix your child, or what that process is going to be like. You know, is she going to be uncomfortable or in pain?
And once you get to that functional range, 60 degrees plus, it can affect your lung function. So you might get winded more than the average person. It can affect cardiac function, your heart function, to make normal tasks difficult to do. We also know that there's a huge mental health component with scoliosis too. In this age of body image and social media, we know that there's an elevated incidence of anxiety and depression among kids with large curves. So she was actually the first, what we would call Risser cast here in Stony Brook. So we brought her to the operating room, put a body cast on it, and she was in that probably for about 3 years.
We would bring her to the emergency room every 2 months, and in the emergency room they would put her under anesthesia, cut the cast off, put another cast on her. And she turned 3, it was every 3 months. After the cast, she would have the WCR brace, which was a brace that formed to her body but would put pressure on the curve to help improve it.
I didn't like wearing the brace sometimes because it would show through my clothes. I didn't like how it looked.
Unfortunately, the curve got worse, and that's when Dr. Barsi suggested the VBT surgery. She was a perfect candidate due to the degree and the amount of growth that she had left.
So vertebral body tethering, or VBT as we like to abbreviate it, is a newer procedure. It's a different way to think about scoliosis. So severe curves of scoliosis are really those that are greater than 50 degrees. The traditional way of treating scoliosis is to do what's something called a posterior spinal fusion, where we put a series of anchor points in the spine, and those anchor points are most commonly screws connected to 2 rigid rods. And we can get you really straight doing that. Okay, but it comes at the expense of motion. VBT has been around since 2019, and the thinking is that we can put screws in the front of the spine, connecting to a flexible tether, and we can harness the power of your growth. So if we slow down the growth on one side of the spine, the other side will continue to grow at its normal rate, and you can theoretically grow out of your scoliosis.
I was very scared and nervous about the procedure. Surgery is a scary thing for your child to go through, but after it processed, it overall is a better decision to have the surgery for more mobility, preserving the spine, and letting Alice, be free to play sports and not be in the brace.
The surgery is done minimally invasively, so we're able to do it with a video camera and 3 or 4 small poke holes in between the ribs. So this is a team approach. So we had Dr. Calabro from Pediatric General Surgery assisting.
Dr. Calabro was amazing. She has a way with children just to connect and engage, and really made Alice feel comfortable and safe. The surgery went extremely well. She's enjoying life now. She's brace-free. She's more confident and feels more comfortable, more flexible, and feels really good. I've learned a lot from Alice. She is just amazingly strong, resilient, determined, and it just very inspiring.
It really shaped her personality other kids. They're tough, but not as tough as this kid.
She's back to all of her activities. She plays lacrosse. I think the biggest change for her is that she no longer needs her brace. So the surgery gives her the support that she needs. And for Alice, I think that's a big deal, but she was pretty much in a cast from her brace her entire life.
Still the same old Alice. She's doing great, even bigger and better than ever.
I like to practice at home with my dad, so I'm actually pretty good at it now. I feel like I can move more freely. It's a little more comfortable.
This case illustrates that we really are on the cutting edge of spine surgery here. I think we take the best care of our smallest patients.
What we'd really love to say to Dr. Barsi and Dr. Calabro, we couldn't thank you enough from the bottom of our hearts. We put our trust in you, we believed in both of you, and we are just so grateful to have you in our lives and to be under your care.